I'm Eli Neal, and today my dad is going to be performing a cataract surgery. So, first things first, he's going to be making two incisions, one small, one large. Through the small one, right here, he's going to be putting in some antibiotics. Then through the larger one, he'll be putting in viscoelastic, which is that stuff that he can see in his hand there. And he'll also be performing a capsulorhexis. Then, after the capsulorhexis, he will be doing hydrodissection to loosen up the cataract a little bit, because the cataract's stuck here. And with hydrodissection, the water pushes it out. It's a little bit more free. And he'll use something called a phaco handpiece, which is essentially just a vacuum, to vacuum it until it's into 4 different parts. And then he will slowly vacuum each part out one by one. Oh, that was weird. I don't know what they're doing. And then after he does that, he will be putting in the lens, and we'll be all done. So right now he is just putting in the viscoelastic right now, I think. And I'll jump back in if anything notable happens.
I can't distinguish 3 lights, no. I only see parts of lights and parts of dark.
Yeah, I know, sometimes it's hard.
I'm looking down again now.
Yeah. Well, you're doing okay. Wherever you go, just keep looking there and don't. Just the thing I don't want you to do right now is be searching around. I just want to kind of have you fixed in one spot. But the place you are now is absolutely ideal. So just keep holding real still. Beautiful. Stay with me. Great.
Hey, where's the feel-good medicine, girls?
Right here.
Oh, you've got a complaint, Vicki.
Uh-oh.
You're not going to get a 99% on your survey. You think she's holding it?
Do you feel like you need just a hair more?
Yeah.
Okay, I'm going to work in just a little bit more for you, okay? It's just me on your IV over here.
Ben, has it been about a year since you've been here?
Yeah.
Does that mean your birthday's coming up?
It's in January.
Taking care of business. All right. This is a really deep eye. I mean, see, like the very back of the cataract's in focus for me now, but all the blood vessels are totally blurry. And it's got to be like a 5 millimeter thick cataract.
Which is a lot.
Yeah, it's a thick one.
Good, I hope that it's going to be better.
It's going to be amazing. You're going to love it.
Really?
Yeah.
Even with my blindness, it's already there?
Well, I confess I don't have your chart in front of me at the moment.
Well, I'm the one who has PXE, pseudoxanthoma.
Oh, that is so cool. Except that it's not.
Yeah, for you it's fantastic, Doc.
Well, I'll tell you what. You know what you'll probably notice is that things will be brighter, you know, but it's just, sadly, it's never going to be 20/20, right?
Right.
But, you know, I feel like patients who have terrible vision are always so grateful if any little bit you can give them,
Yeah.
you know, can really mean a lot.
Well, I'm hoping some of that fog will diminish that's in front of
Right.
my eyes.
You know, it will. It will.
That will help,
It's definitely going to help.
because it seems like my eyesight the last year has just went downhill even more so with the fogginess.
Yeah, Ben, she has a pseudoxanthoma elasticum with angioid streaks, which honestly, and I've only ever really seen in a textbook. I'm not sure I would have made that diagnosis just because it's such a zebra. But you can see her, like, her fundus reflexes. I think it's just like a little bit, just not as orange as you normally see. It kind of looks like, it looks a little bit like retinitis pigmentosa, like there's a pigmentary retinopathy.
I've been diagnosed with that, and I didn't quite believe it, but I wasn't sure either.
It sure looks like it.
Retinitis pigmentosa?
Oh, they said you had retinitis pigmentosa too?
Oh, the one doctor in town did, the
Yeah.
retinologist.
That's probably what I would have said because it just looks like that.
But then it comes down to it's PXE, so I don't know.
But do you have other symptoms like your skin
Oh,
is really
yeah.
stretchy?
Yeah, extreme, so.
Yeah.
Actually, I'm, 23 years old, and I look 73.
Oh,
No, yeah, it does play
I'd rather be the other way around.
a number on your cosmetics.
Yeah.
For sure.
Have you always been really flexible in your joints?
Uh-huh.
Huh.
Pretty flexible.
How old were you when they made the diagnosis?
I was 21.
So what type of problems were you having
I
at that
was
point?
just at that time, the optometrist I went to see about getting my glasses
Uh-huh.
said that he saw android streaks in my eyes.
Wow, he was a sharp one, huh?
Yeah, and he was just out of school. He had another one of his friends come and look at him, at my eyes.
Man, I bet they had never seen it before. Good for
They
them.
were,
That's really impressive.
but they told me that nothing would ever come about it, that just to make sure I don't get my head bumped really hard or
Huh.
play, contact sports.
You've never had a retinal detachment?
No, but
Well, that's good.
no.
They can also get this other disease called keratoconus, where their eye is shaped kind of like a cone instead of like a ball, and has horrible vision. But that's another thing you don't have. So
Oh, really? So
Yeah.
that's one of the side effects of it.
yeah, so I guess we can count our blessings a little bit. Even though it's not great, it can always be worse.
Oh, boy, I know that. And about the time you think it can't get worse, it does. So,
Can you do me a favor and just look right at the microscope one more time?
microscope,
Yeah.
okay, is it?
I'm just closing the incisions, and I just need the eye really still for that. Beautiful. Wick. Be a 2-wick case here. Yeah, it looks good. The way we do this to avoid the need for eye drops, because I've changed, maybe in this past year I've changed. So this is a compounded mixture of moxifloxacin and dexamethasone. Dexamethasone's great because it lasts a couple days. So then this is Kenalog, right? So you can see that's white. So then I'll put about 0.3 cc's of this Kenalog. This might stink.
Okay, we're on camera. So he's putting in the steroids and he's just about done. So remember to like, share, and subscribe if you found this interesting at all. Okay. Thanks for watching. Goodbye.